I'm your host, Marsha Florence, for Just Ask. Today's show, ladies and gentlemen, is Primary Care with Dr. Lonnie Joe. Hurry back and join us. Hi, I'm your host, Marsha Florence with Just Dance. Today's show, ladies and gentlemen, is Primary Care with Dr. Lonnie Joe. Now, let me say this. You know I have to say it. Is there a doctor in the house? Yes, it is. It's Dr. Lonnie Joe. Good afternoon, Dr. Joe.
Marsha, thank you so much, and thank you for the invitation.
Well, thank you for coming. Now, Dr. Joe, I had to say that because, I want to make sure that we understand here that there is a doctor in the house, and today's discussion is about you and your services and what you do for our people in the state of Michigan. All right, now I say the state of Michigan because you could be anywhere, okay? So we just want to start off. So Dr. Joe, give us a little insight about your practice.
I've been in practice as an internist and a pulmonary specialist over 30 years, and it's been a joy to have the privilege of practicing medicine, especially to interact with the patients and the families. That's really where you derive a lot of insight as well as pleasure from practice of medicine. Modern medicine, practice of medicine now is such that, we're treating things very similar because we have the ability to communicate, and how we treat heart failure in Los Angeles and in New York or in Ann Arbor. I mean, they all come so close together. It's sometimes not an ounce of difference, and you have to find ability to derive some pleasure out of this more than just, the medicine side of it. So I've enjoyed it. In my practice, I've enjoyed the people aspect of the practice of medicine. That has been key for me. And over the years, we've taken care of lots of people, lots of families, and hopefully provided a good service.
Okay, well, obviously you have because you're on the Just Ask Talk Show. Okay, so I do know that, I know this is like a family thing now. So your wife, your son, all of you are in medicine?
That's correct.
Okay, so what does your wife and son do?
My wife is a longtime faculty member at the medical school in Ann Arbor, professor of radiology, who specializes in diagnostic breast diseases, basically limiting herself to the diagnosis of breast cancer in women, and she's just done a marvelous job. She loves it. She'll say, "Oh boy, I can't believe they pay me to do what I do," but she loves it, and she works hard at it. But it's what she loves, and has been doing it for a long time. My wife, I met her first day in medical school.
Oh, wow.
She was 19 years old, had already finished undergrad, and basically just knew what she wanted to do. She was focused. She knew she wanted to be a doctor. She didn't know what kind at the time, but she knew that's what she wanted to do, and landed in radiology, and in particularly breast care for women, and that just took off for her. She's like a fish in water. She just loves it. My son just recently started as an anesthesiologist at the medical center downtown Detroit, and he's kind of the same way. Oh, Dad, I just love what I do, and he's gotten through all of the hills and mountains to climb to get to that point. But he's really enjoying himself and is in tune with what a physician is supposed to do and where our attitude's supposed to be. And I don't know how he got like that, but he got it right.
Okay. Well, family of medicine, and that's a wonderful thing. So, Dr. Joe, let me ask you this. So, right now we are, the state of Black health. Where are we at in the state of Black health with African Americans as far as like diabetes, healthcare costs, clinical testing? What's going on with us?
Excellent question, Marsha, because even though there have been scientific gains made, the knowledge base has increased, we still find ourselves trying to improve the gap in terms of care. And that care is a broad definition because it's not only just the care of the patient, it's everything else associated with it that broadens that definition of care, whether it's insurance, whether it's family, the ability to afford the medication, insurance questions that we're all suffering through right now. All of that encompasses this whole conversation about healthcare. And when it comes to African Americans, not just this community, but in any community, we find ourselves still trying to close the gaps. Unfortunately, in some things where we've made progress, we're now losing progress, and that's kind of sad that we can have more discoveries, have more of a knowledge base, and we begin to lose ground. And there are lots of reasons for that, but basically, those are the facts. That's the landscape where we're at right now. So name a disease state, and we got issues. We're still behind the curve in terms of catching up.
You know, but when I hear something on the news when they say the percentage of African American women are likely not to receive proper service for breast cancer as opposed to the percentage of other races, you know, the Caucasian race or whatever, I'm trying to figure out, well, why isn't it not an equal playing field that we're women, period, and we are going through a crisis of our health, and it's not an equal playing field?
Another good question. The problems are multifactorial. We tend to focus on one or two problems on a long list and think that those two are going to make up for the others that go unaddressed or where the need still remains, okay? Breast care and breast cancer, like you mentioned in women, is the same. Now, black women don't get breast cancer as often as white women. You're down on the lower end of the scale. But when we look at the deaths of women who have breast cancer, you lead the way. So there is a disconnect. There is a distance between equalization that you have to actually address. And if you don't address those things, you're going to always have the disparity. Part of the root word of disparity is parity. We have talked about disparities till we're blue in the face, but we have not been able to achieve parity. That's an educational situation, which is what our show is all about, education for patients in terms of what you should be doing, the questions you should be asking, those kinds of things. So when we see these kinds of numbers continue to be produced every year by a mega gazillion dollar healthcare system, we're saying we're doing something wrong. So we have not begun as yet to address the kinds of areas in that whole spectrum of things that need to be addressed. We've limited ourselves to a little bit of success over here, and we want to give ourselves more credit than we really do because we addressed one or two issues. We think that's going to solve the whole problem. That's the crux of the matter right there. We have not had the push of all hands on deck to actually say, what do we do about breast cancer? If we associated ourselves with a endpoint that would say we can get outcomes that would be better for black women, outcomes for all women would be better.
That sounds good to me.
We do not have to make healthcare a black issue.
Right.
But it is.
Because healthcare is healthcare.
There you go.
So I tell you what, we're going to take a break, and ladies and gentlemen, we'll be right back with Primary Care with Dr. Lonnie Joe. We'll be right back.
I try to keep up with what these young people is doing and knowing.
I was at work and I just got a text from a number that I didn't know.
I sent him a text. He texts me back and say, "Who dis?" And I just thought that was the funniest thing.
The next few weeks, you just made fun of me, like would answer the door and say, "Who dis?"
Who dis?
Drop off a warm meal and get more than you expect. Volunteer at americaletsdolunch.org.
America, let's do lunch.
And welcome back to the show. Now, ladies and gentlemen, you know, if you're just not joining us, I have to tell you, get your pens and paper out because you got questions. So anytime you see a guest on the show, such as Dr. Lonnie Joe or any of our past guests, you can always give us a call, 1-800-323-5336, or email me at Marsha@JustAsTalkShow and say, "Hey, Marsha, I got a question and I want to get connected with your guest." So you're more than welcome to do so. So today, Dr. Lonnie Joe is giving us some insight about his career as a physician and his show, Primary Care with Dr. Joe. So, Dr. Joe, let me ask this question: how did you come up with the concept with primary care?
I can't take credit for developing the concept, but I can take credit for being part of the conversation in terms of how this really got started. I think there were some attempts before our show got off the ground to do this, but it just didn't work. Just didn't.
Wasn't time.
It wasn't. The timing is everything, and it wasn't time for it. Even though there was a big need, the timing wasn't correct. But when we got rolling, I was sort of, well, okay, this is a good thing to do. It, as the kids say, it got off the chain.
Okay.
The phone calls, the emails, the snail mail, the need that the public had, this appetite that they had, clamoring for information said to us, boy, we're on to something here. We really can provide a real service to the public. And that public turned out to be, when we look at the focus groups and stuff, it's the senior citizen population
Oh, yeah.
that we hit. It's just tremendous in terms of not only what people want, but also what they don't know. As I was saying earlier, one of the big things that we ran into initially was how do we dispel some of the myths that people have about healthcare and a lot of the things that we do as providers. That was a big challenge to actually put a show on in a short period of time and actually address some of those things, and at the end of it say, we got the point across. We can walk away from it and say we did a good job. And that has continued, and over time, it's gotten better and better. The increments,
Oh, yeah.
you know, are there, and we're proud of this.
Well, you know, I wanted to bring up some photos of some of your show clips, and let me say this: one thing about a show like yours and mine, it's well needed because a lot of people don't read, can't read, won't read, whatever the circumstances are, and they like to sit still and actually get firsthand information if they can see it visually.
Right.
And I believe that when they see a person on TV and they get to address it, it shows compassion, it shows concern, it shows integrity, all the things that encompass making sure that that person understands what the subject matter is about. So give me a list of some of the shows that you've done. I know we have a list of some of the people you've had.
Well, since we've been doing this for a minute, I'm not sure that there's a medical subject matter that we have not touched on. I mean,
Okay.
in and out of medicine, we've done shows on the caregiver situation, which you're an expert on. We've done shows on cooking and preparing food. We've done shows on exercise. We've done shows on marijuana and the role that it plays in all of this. We've got the lead guy in the country right there in Ann Arbor who came to one of our shows and just help the public understand where this is, not only in terms of research,
Okay.
but how it actually fits into what we're doing in terms of healthcare. I've learned a lot too, Marcia, in interviewing these folks who actually do this. They're the boots on the ground and to the original first responders and sort of this stuff. So from the medical side.
So let me ask you this. So the screen, the photo we have on the screen, these are some of the shows that you've done in the past.
Absolutely. Look at the first one, Achieving Healthcare Equity in Detroit. We didn't talk about drugs or disease state or everything. We talk about the actual rounds that you got to make to actually make something happen in equity in Detroit. The complaints come in from patients about everything in healthcare. Everybody's got a story to tell about what didn't go right. We're trying to balance this out to some degree and say, look, here's a way to address these things, okay? The young lady here was a expert in hair loss and hair growth,
Okay.
local physician who basically got a lot of responses from that show because I used to have hair. Come on, probably need to see her.
We all
okay?
have, okay?
Right,
So we
right.
all need to see
Right.
that. I mean, you have some dynamic, subject matters here from, breast cancer awareness, kidney disease awareness, skin condition and hair loss, Black maternal health. So, asthma, all these things hit home for everyone. And it's not just African Americans, but people in general. So whoever is tuning in automatically should become knowledgeable about something in the medical field.
Absolutely.
Okay.
There's no way that you can watch this show and not benefit from it from a knowledge base. Okay? Even physicians who watch the show will contact me and say, by the way, what about this? What about this direction in doing things? There is a real need for this information to be dispersed in a community like this. And that was the aim of the show in the beginning, to raise the knowledge base
Yes.
that people have on as many disease states as we could get out there.
Yeah. I know we have a photo of you and your wife. So gotta see if we can find that. But there's Mrs. Joe. Okay, okay. So how did you guys come together to do a show?
Here again, our producer said, we want to do both of you together, okay? We said, fine. She is very, very astute in this whole breast cancer discussion, which at times turns into a situation of why can't we get the gaps closed, okay? And that's important because you don't want to see people die from a disease that is preventable and where we can treat. People have all kind of notions about what happens when you're diagnosed with cancer, and you got to work through that maze of helping them get to the point to say, oh, I get it, I understand, this is what I need to be doing to help myself. And breast cancer is one of those things that we are still behind. If you look at some of the statistics that come out of Washington, D.C., our community is not doing well in percentages. Breast cancer is one of them, and unless we help people understand the challenges and also the outcomes and how you can better your lot in any disease state, especially breast cancer, they won't know where to go, where to get it, because sometimes we're not getting the message across from the pulpit.
Well, you know, Dr. Joe, one thing about medicine in itself, we as the patients look towards the physician to give us the knowledge and the, feedback to tell us what it is we should and should not be doing. You go home and you all of a sudden you got this mounting of fear over you that, you've got this health challenge that you got to either fight and win or lose and die. And so depending on the person, the strength of the person and the strength of the family, if they have family, that's an important step to take when you first find out that something's going on. I'm going to have to take a break, but I tell you what, we're going to come back with that very question about where it is, the person, how persons draw strength from knowing that they have a condition that they have to fight to see if they're going to live or die. We'll be right back with some more good information about primary care.
This isn't a workout video. It's about how LLS has helped blood cancer patients like me thrive and how your donation can help countless others. Please give today at LLS.org.
We see champions everywhere we look. In every sport, on every court, we're building a foundation to ensure all athletes are safe, supported, and strengthened. At the U.S. Center for Safe Sport, we're shifting sport culture because every athlete deserves to compete free from abuse.
And welcome back now, ladies and gentlemen. You know what? This needs to be an hour show, not a half an hour. So we're going to ask Dr. Joe to definitely come back and join us again because a lot of you have questions. So, Dr. Joe, I know I left off with some important information, but I'm going to piggyback from that and say that a lot of people are always concerned, like when they go to the doctor, how do they actually get the questions answered? People get confused. I want to ask my doctor about this. I'm going to tell him I got this bump here. And some of them don't know the language, the medical language. And then some of them are skittish about telling their families what's going on with them. But they should be included because care to me means everybody on hands on deck, not just the patient themselves. So how do we get people to feel more comfortable in relating to their physician about their condition without feeling like it's an embarrassment or a shame or anything like that?
I think that the more you have the conversation, the more patients become comfortable with it in terms of talking about whatever it is. When the words are not being spoken, it's a bad thing. You have to do it not once, but you have to do it as often as necessary to keep that line of communication open with people concerning their health care. And it's not just the doctor, it's the family and the support group that they have around them also, okay? We just did a breast cancer thing. We had 300 women there, and one lady stood up and said, my aunt had cancer, I have cancer, my sister had cancer, and we weren't talking to each other, so between the three of us, none of us knew that we all had breast cancer, which is like unacceptable, okay? But I can help you get through your journey compared to what you were told. So the conversation has to be held, and it has to start somewhere, and it also has to be continuous because the conversation is going to produce more questions. That means you're going to need to get back next visit, a phone call, whatever, to say, what about this? How do we handle this? Is this something I should worry about? That needs to be an ongoing dialogue. When we reduce it to a 20-minute office visit, we make mistakes.
You know, and a lot of people say, well, don't tell, my wife will say, don't tell my husband will say, don't tell my wife.
That happens.
And I'm trying to figure out, well, wait a minute. I'm going to end up being the caregiver. Shouldn't I know firsthand what's going on with you so that I can help you through this journey? And the doctor is held by the HIPAA law not to repeat anything. And the patient is hiding something that really could be handled through the entire family. And definitely, I'm always concerned when people say, don't tell the kids.
Right.
I mean, you know, kids are going to be adults one day too. And not to say that kids shouldn't be privy, but it's almost like, what age do you include your children in these conversations about mom and dad's health so they can be hands on deck and everybody included?
It is our responsibility to talk my patient or your patient into broadening the conversation. It might take a few visits to do that, but it's still on your radar in terms of your communicating with the patient, okay? One of my biggest fears, Marcia, in my practice is that the caregiver dies before the patient. I'm really in trouble then. What am I going to do? Take them home with me? Not possible. So I need the input. I need the support mechanism around the patients, not to mention there are a lot of patients who don't have support mechanisms, okay? So it's a catch-22 a little bit, but at the same time, it's all about having the conversation that actually addresses what the immediate needs, the potential needs are for any particular patient.
Right. And I think that everybody should start, educating their entire family about the condition. You know, people do a special segment when a child dials 911 and say, I saved my mom who fell out on the floor.
Right.
Well, okay, you didn't tell your 10-year-old you had epilepsy, but
Right.
you could,
Right.
you could say, if mom should fall out, this is what we want you to do.
Exactly.
So when do we start? We start as early as possible so that the child will know that mom's not asleep, something's really going on
Right.
with mom.
Right.
And for some reason, over history, families have done the same thing over and over. Nope, don't tell nobody. Nope, I'll tell them later. And then when they see the doctor, they tell the doctor, don't tell them, I'll tell them, and still hasn't told them. And then the matter has gone from bad to worse.
This is 2025, and that happens every day.
Yep, and I know.
And it shouldn't happen.
Right. It happened in my family, so, I want to talk about it firsthand. But we do have some photos like, to me, this is one of those photos when I say bedside manner. So I just love it when I see a physician talking to a patient and getting him or her to understand clearly what's going on.
This is a gentleman who did not understand the testing that we wanted to do on him. And it was a simple conversation for me to have with him, but the people in the system itself that's trying to say, you need to go down for this test, and he's being resistant and stuff, it took just a little time to sit down and say, look, this is why, this is what's going to happen, this is what we need to do, and he accepted it. Now, the other problem is that patients who are skeptical aren't going to listen to just anybody or
Correct.
everybody, okay?
Correct.
So the onus is on the person with the relationship to say, look, this is what I want you to do. In essence, Marcia, people basically are paying us for our opinion, okay? Giving them advice on what needs to happen next. Take a pill, take a test, do this, that, whatever it is. They rely on us to come up with the solution or the next best thing for them to do in terms of healthcare. Right. And that's what this is all about. Sometimes we get a little short. Time is short. I was running late today getting here,
That's okay.
because of these things.
Okay.
But here again.
But we trust into our physicians. And so I believe that for me, I always want to be able to talk to my physician and make sure that I'm not intimidated by them, uncomfortable with them. And I even say, bedside manner is number one with me. If I can talk to you, I feel like I can tell you anything that's going wrong with Marcia.
It's like dating.
I mean, it really, it truly is, okay? Because my first date means that I should be able to tell you, about Marcia. So I admire that. And I think that everyone should get to a point where they're comfortable with their doctor and not fear that person to tell them, hey, I got a pimple here, I got, a scar here, especially those with wound care. So you got a gaping wound somewhere and you don't want to talk about that gaping wound, but it's not going away. And it's going from bad to worse. I always look at people, I'm like, why didn't you just tell the doctor? Oh, I'm going to tell him. What's up?
Right. People are stoic to some degree. They don't want to be sick. I mean, that's most people. Then there are other people who will tell you everything, more than you really want to know sometimes. But here again, it's the communication factor. That's the connection. That's the bridge in terms of getting from point A to point B. And sometimes we don't do it very well, okay, in both directions. Patients don't talk enough to us about stuff or open up enough. Or one of the shows we did was on depression in men. It is the #1 show in our whole system of shows that we've done.
In your catalog? Okay.
Yes, because
It's real.
it's real, and until we discussed it, you had no idea that everybody out here was having an issue.
Right.
Okay.
Right.
So without having that dialogue, we don't expose ourselves to or improve our ability to help people sometimes.
Right, right. And the flexibility of seeing men and women patients is always, a thing too, because a lot of people don't realize that when you're dealing with male and females, the dynamics of getting them to understand that, hey, I'm comfortable with what your subject matter is. I just want you to be comfortable in expressing your subject matter.
Right. That's here again. That's something that you have to learn to engage properly with. It's something that we should have already had just by being in a family. Okay, but sometimes these messages don't get across. Even in a single household, we don't know what's happening sometimes because that dialogue, that discussion is not taking place.
Well, Dr. Joe, I tell you, you came in today with a wealth of information. I got to ask you to come back because,
glad.
medicine is nothing that we can just quickly run through. So definitely had to have you, join us again. And we want to close with a nice opening of your show. So definitely have people tune in to Primary Care with Dr. Lonnie Joe. So will you come back and see us again?
Absolutely. Your call.
All right. Okay. My call. I'm going to remember that. All right, ladies and gentlemen, you know how I am. I'm your host, Marsha Florence with Just Ask Talk Show. And you're going to catch Dr. Joe's show, Primary Care, on PBS Channel 56 as well as you catch Just Ask Talk Show. So I'm your host, Marsha Florence with Just Ask. And what do I always say? If you have a question about a person with a disability or just a general question, don't be afraid to ask Just Ask. I'm your host. Thank you.